Welcome friends. My name is Kate Breslin. I'm the president and CEO at the Schuyler Center for Analysis and Advocacy, hosting today's panel conversation focused on addressing child poverty with a particular focus today on immigration. We are so excited to have you here for this conversation. We know that for children in immigrant families, there can be barriers to healthy growth and development and barriers to services that support their well-being. And this conversation today with immigration and policy experts will focus on how New York can best support all children. And so we're very excited to have our panelists who will introduce themselves shortly. Liza Schwartzwald, Director of Economic Justice and Family Empowerment at the New York Immigration Coalition. Carolina Tenecela, Community Health Director and Life Program Coordinator at Little Sisters of the Assumption Family Health Services. And Lillie, Hinkle, Associate Policy Analyst, National Center on Immigrant Integration Policy at the Migration Policy Institute. It's a fantastic all-star cast, and we're excited to get going with the conversation. So a quick run of show. I will talk a little bit about New York's Child Poverty Reduction Act, and we'll then ask the panelists to do self-introductions. We'll ask them some questions about some of the challenges facing children and immigrant families, and then move to solutions, public policy recommendations that we have that can be implemented right here in New York and or nationally. And throughout, we encourage you to use the Q&A function, and we'll do our best to get to questions sort of either as we go, when there's a logical break or a logical moment for it, or toward the end. So once again, welcome. And the Child Poverty Reduction Act is a law that was passed in New York State a couple of years ago, signed by this governor, Governor Hinkle, and it commits the state to cutting child poverty in half over the next 10 years. And so it sets New York on a path to intentionally start taking the steps that move the needle on child poverty. But importantly, the Child Poverty Reduction Act doesn't implement any concrete policies or budget actions that will reduce child poverty. Rather, it creates an expectation that the state will reduce child poverty explicitly with attention to racial equity, and creates an advisory body to put forward evidence-based, evidence-informed proposals and recommendations that will move the state forward on reducing child poverty. It also requires that the council assess the executive budget, the state's executive budget, and the budget with regard to its child poverty reducing impacts. So here in New York State, more than a third of children live in immigrant families, and almost a third speak a language other than English at home. Children in immigrant families experience poverty at much higher rates than other children, negatively contributing to their developmental outcomes. The higher rates of poverty can be attributed to immigrant families earning less than native workers, and because they face more barriers to government support. The barriers are largest for children of undocumented immigrants, and families of legal immigrants face obstacles too. So today we have an extremely timely and exciting panel planned to dig into the issues and connections across child poverty and immigration, exploring recommendations and solutions. So I'll start by asking Liza to introduce herself.
Great. Thanks so much, Kate, for the wonderful introduction and the setup. So as Kate said, I'm Liza Schwartzwald. So I am the Director of Economic Justice and Family Empowerment at the New York Immigration Coalition, where I focus on just these things. So early childhood and child care, workforce development, adult education, all of the things that make families and immigrant families in particular more economically resilient and able to thrive in New York State. So I'm very happy to be here with you all.
Thanks. Carolina, would you introduce yourself?
Yeah, of course. My name is Carolina Tenecela. I'm very happy to be here as well. I work as Community Health Director at LSA Family Health Services. We are a community-based organization in East Harlem, and are working one-on-one with immigrant families for over 65 years, addressing all kind of social determinants of health, and just trying to offer as many services as possible.
I can just jump in here, Kate, and introduce myself. My name is Lillie Hinkle. I am an associate policy analyst at the National Center on Immigrant Integration Policy at the Migration Policy Institute. And what we do at the center focuses broadly on a swath of integration issues, including workforce development, language access, early childhood education and care, K-12 education. I come to this work with a background in refugee resettlement specifically, and I'm largely focused on the trajectories integration-wise for humanitarian populations, broadly speaking, as the landscape has kind of shifted by what we mean when we say humanitarian populations, but more on that later.
Thank you, Lillie. And thank you all so much for being here today. We are super excited. So we'll jump right in. Lillie, can you speak a bit to the landscape of child poverty among immigrant families nationally and or here in New York State? Just a note that Migration Policy Institute is a national organization. And how immigrants fit into the workforce. What challenges do immigrant families face in being economically secure?
Yeah, so there's a couple of big picture points that I'd like to make before digging into some of these nuances around access to workforce and some of these barriers to economic stability. I think, like you said, big picture, we know that immigrants experience poverty at a higher rate, particularly children. NPI has gathered in 2019, based off census data, that 1/3 of immigrants in the United States are low income, and 17% of those live below 50% of the federal poverty level, which is something that we call deep poverty. We know from other researchers that there are much higher poverty rates, as you said, amongst children in immigrant families as opposed to non-immigrant families. It's a rate of around 21% as opposed to 10%. And in the case of New York in particular, there are around 1.1 people living in poor immigrant households, about half of which are children. So I think with that, it's important to understand what we mean when we say immigrant families, how the circumstances of folks' admission into the country or entry into the country can affect their trajectories. So I think there are a lot of different sorts of immigrant families. It's not a homogenous group, but we've got our unauthorized population, we have lawful permanent residents, and then we have this large population that's increasingly growing, particularly in the past 2 years, which are humanitarian populations. And this includes folks like refugees, asylees, asylum seekers, unaccompanied children, most recently parolees. It's folks that are in the United States through a humanitarian justification. And I bring all that up just to say that I think it's really imperative to understand some of these key differences in the different statuses, because in many instances, these differences in status are the reason that we see a lot of the disparities in access to services, the formal or informal workforce. Depending on status, some immigrants only have access to the informal labor market, for example, which can certainly result in a risk of exploitation, wage theft, hazardous conditions. But folks that are authorized to work may also experience unequal access to the labor market as a result of their language barriers. They may have lower levels of education reflecting the development in their country of origin, or they may have very limited access to recredentialing in the United States, and they're forced to take jobs that are significantly lower in wage or position compared to where they were coming from originally. And I think all of these things can generally result in economic insecurity. The labor piece is a big one, definitely. But as you said, Kate, it's also this access to benefits and services that I think is really important. There are a number of barriers to accessing benefits and services, some on the basis of status, some on the basis of previous policies in which folks are really scared to interface with government services. Depending on your status, it can have huge impacts on what you have access to. If you're someone like an asylum seeker, or you're someone benefiting from temporary protected status, you're unauthorized, you have access to virtually nothing that is nativity restricted. And this can, I think, have huge impacts if you are struggling economically, if you just need a little bit of help. Programs like SNAP, programs like TANF can be really life-saving. And some folks don't have access to that on the pure basis of their immigration status. And this does include children. So, for example, in 2019, MPI has found that a little over 2 million income eligible children, immigrant children, were barred from accessing Medicaid or CHIP on the basis of status alone, which has huge impacts on their health outcomes purely on the basis of status. And for folks that do have eligibility to some of these programs, there are almost no systematized federal means of connecting them to those benefits and services. So folks that are entering with access, usually under humanitarian justification, they have no way of getting connected. They don't know that they do have access to some of these benefits and services. And by the time they figure it out, it's too late. And I think this is particularly important to consider because missing out on these services can have huge impacts for long-term poverty for these families, particularly children. And children for me, and I'll end on this, is children for me in this particular area, the area being benefits and services, I think is really interesting because so many children of immigrants are eligible for a lot of these programs and services, but they don't access them, or they are perceived to be excluded from them because of previous policies or restrictions that are imposed on their parents or their other adult family members, where those adults are not able to access a lot of these benefits and services, but the children are, and they miss out because of fears of interfacing with some of these systems, because of previous policies under the Trump administration. There is just such a deep, we call it the chilling effect, and we can talk more about it later. But this chilling effect is imperative to sort of mitigate in order to reduce child poverty amongst immigrants, in my opinion. But to zoom in a little bit more on New York, I'll pass it over to fellow panelists.
Thank you. Wow, that's a great kind of overarching view. And yeah, I think what some of what you talked about raises for me this, that'll probably come up, that does come up a lot throughout our conversations, is what have, federal government policies and where programs originate, certain programs, and then what states either can and can't do or choose to fund or not choose to fund. So Liza, I'll ask you, shifting a bit to New York State, to talk about sort of why poverty and child poverty is particularly pronounced among our immigrant families, although I think we've started to touch on that, and some of the systemic barriers that we in New York can try and impact.
Absolutely, thanks. And I'll hop off of kind of what Lillie started us off on, because I do feel that the federal benefits and the limitations on those benefits affect New York immigrants even more so than just for the federal money, because unfortunately, and I think we've seen this happen in a few spaces, childcare is a great example of this. Even where there are limitations on federal money, when New York spends more than they have to match on their federal money, and we do spend quite a bit more in a lot of areas than we have to spend, by federal regulation, New York has continued to continue tying state money to federal eligibility, right? Purely because of administrative ease. So for example, our governor, I believe in her first year a few years ago, passed $7 billion in childcare funding over 4 years, but didn't take any of that money and say, well, those childcare subsidies should be for all children and not just the children that are eligible for federal funding. And what that ended up doing was, limiting state money that didn't need to be limited. And we see that in a lot of spaces where we could pass legislation very easily saying, we're not going to discriminate based on, the immigration status of the child, and our New York State money should cover all children regardless of immigration status. And we've tried to do that a few times. I believe Senator Brisport was the most recent trying to pass a piece of legislation that did say, no, we're going to actually look at the situation that we have, and we're going to say, we can spend our state money however we want to, and that money should be used to include all children who need it and not just those who are documented. Children don't decide when they come here and when they don't. Our children are here because their parents have brought them, because potentially they needed to be here. Maybe they were, as Lillie stated, part of humanitarian crisis, but regardless, they're here and they're children, and they deserve to have those benefits. I think other pieces, and I would say the biggest piece beyond that is probably English language acquisition. Income is highly correlated to literacy and to English literacy more broadly. Those who read at a higher proficiency level make something like twice as much. I think it's like 63,000 is the kind of average if you are considered literate. It's about 30,000 or so if you're not, if you have low literacy or low English language ability. Now, currently in New York State, we're serving less than 4% of the people who need either English language classes or a high school equivalency. It is, an extremely low number based on the need. And that was the number before asylum seekers started arriving. So this is not a new problem that we've seen. And in fact, I believe there was a report by, I want to say it was the Barbara Bush Foundation back in 2020 that stated that New York City alone walks away from a full 10% of its gross domestic product, of its GDP, because of low literacy and English literacy levels. And we can see, we can take that and look at it and say, okay, we know that people with lower English literacy don't make a lot of money. And we know that many of our immigrant families in New York City or in New York State rather, and Lillie had given us that number, lack that proficiency. So there's a real direct correlation. And of course, many of those people are parents. So when a parent can't speak English, when they're not able to get a job, they're not able to lift themselves out of poverty the way that, we would like to have them be able to. Digital literacy is another one that, we've seen a big lag on in recent years. I think as far as the pandemic has gone, many things moved online. We're online right now. And a lot of enrollment, a lot of benefits acquisition, a lot of these pieces have moved in New York State into either almost entirely or entirely online modes. Now, in New York City alone, and this was, I think, MPI data, so thank you for that, but in New York City alone, parents of 0 to 4-year-olds, there were over 165,000 parents of 0 to 4-year-olds who either lacked access to the internet or a computer or both. Now, you can imagine if you have to enroll in benefits, enroll in school, find a childcare provider, find a food bank, find a job, that you would need to be connected digitally to help do that if all of our resources are starting to be moved online. And that's also just been a major hurdle for our immigrant communities as they've come in, because often they're working off of maybe one phone and they're using Google Translate, right, on that phone, on that website, if the website even has that capability. So we're really looking at just a huge access to entry barrier. And then, a language access barrier. We've pushed in recent years to get language access expanded to require that many of the state agencies have to translate everything. And right now they don't have to. Right now, many things still don't need to be translated or interpreted. And that means that either a family is on their own, or if they're lucky enough to find a community-based organization or a partner, or they happen to get the right staff member at the agency that does speak their language, maybe they speak Spanish and they have a higher likelihood of that happening, then they can get those resources. But if not, they tend to get completely cut out. You know, getting families accurate information about what they are eligible for is a huge hurdle. And realistically speaking, even sometimes many of the people who work on staff doing enrollment don't properly understand their own eligibility. So they may not understand what a qualified immigrant is, you know, in the course of getting a child care subsidy, for example. And so they may be telling families incorrectly that they're not eligible for things they actually are eligible for. And of course, we do see the freezing effect that Lillie mentioned as well, where even where an undocumented child or a child that is documented rather, may be eligible for a service if they're in a mixed status family. So if they have a family member that maybe isn't documented or doesn't have a social security number, immigration status, then they're too scared to go and actually get that assistance because they are afraid that they're going to get deported, that that someone's going to take their child from them, perhaps. And those are real valid concerns that I think we really need to address as we, look at these issues. But I know we're going to get into it later. There are definitely a lot of things that we can do to improve these barriers. They're barriers and they'll stay barriers. But New York's strength is really, I think, in its diversity and in its, in its immigrant communities. And so it's important that we remember that as we, consider the barriers that we need to address to make sure that all of our New York families thrive.
Thank you. And thank you for that reminder transition that we are, for those of you who are feeling overwhelmed, we are going to talk to about, policy solutions and recommendations. We thought it was important to really lay out the landscape of what our partners and experts are seeing. So zeroing in even farther, or zooming in even farther, Carolina, from your experience, and I know you are at an organization that's working directly with families, what opportunities and barriers are immigrant families currently facing with regard to accessing what they need to enable them to best support their family?
Yeah, thank you so much for this question. So obviously I can speak a little bit more about New York City because that is what we have encountered. East Harlem is a very diverse little niche within Manhattan, and about 75% is Hispanic. And so that means that we have the bilingual schools, a lot of the bilingual schools here, and we're getting a really huge influx of the recent arrivals, asylum seekers, all kinds of people who have just entered the country at our doors. And currently downstairs, they're receiving people, they're, asking for codes. And so we're really getting kind of the full experience of seeing what the needs are and the stories that they're telling. I think that's really important to kind of convey as well, because there's all of this misunderstanding about why people are here. You assume they just come for money, or, they just kind of wanted a better life for themselves. So you don't realize like the extreme trauma that they had to go through at their home, where they had to leave everyone they knew, everything they knew. A lot of them had like businesses. They were, had an entire profession back home, and had to leave. And the common story is they left for their children, right? They've had families that were assassinated. They've had, people tailing them. And at some point, they're just so desperate to save their children that they made this decision to abandon everything they had, sell all of their stores, everything they possibly, that belonged to them, and leave their country, risk their lives and their children's lives to arrive into a place that is not as welcoming as it should be, that they can't even work, right? Because a lot of them don't even have a worker's permit. They can't like fend for themselves. They don't know the language. So it's a huge culture shock. And like seeing, we walk into work at 9 a.m. and there's already an entire line there waiting for clothes, for food, for any kind of resources that we can possibly give them. And that's not our primary job, but we what can we do but react, right? So LSA has been, really, really trying our best to kind of provide anything that we can. We ask for donations, and we have an entire room stockpiled and ready for emergency hygiene, for like underwear. A lot of them just have the one clothes that they came with, especially when they're incarcerated. They cross the border, they lose everything. They don't have money, they don't have, a lot of times they don't even have a cell phone, which is actually really difficult to be able to access then the resources, right? So if someone wants to offer you a job, even if you don't have a worker's permit, how are they going to call you if you don't have a phone number? How do we make an appointment for you to apply for food stamps if we can't call you? And so it ends up being, they have to mobilize themselves in any way that they can. They have to buy a Metro card to be able to arrive here, a lot of them on 43rd Street. And that's about 50 or 60 blocks away. Some of them walk, and some of them, have to take the train. They have to jump the turnstile in order to arrive. And this endangers their court cases, right? Because this is not necessarily the most legal thing. And so they're exposing themselves just because they need to be able to provide resources for their family. So, these are some kind of the barriers. New York does have amazing resources. We have social services like agencies like ours, community-based organizations, there's faith places, there is lots of food pantries. However, you have to know how to navigate the system, right? In order to apply for school, you have to either have, you have to do it on My School's account, you have to do it, there's a whole system to it, and you have to have internet, you have to have a smartphone, you have to have something. You have to understand the language, because even a website sometimes has translation, but all of the answers are in English. So there's no there's no real translation. And you need, people to be able to kind of navigate you through that, to give you the resources. Sometimes we run out of clothes, we have to send them to other places. We're not sure if they have clothes. And now that the winter is coming, we are seeing a lot of more fear, right? A lot of people, they come from South America, from Central America, from Western Africa, and they're not used to the cold. And so even with this weather right now, which is really not that bad, they're already bundling up, they're putting their gloves and their scarves on, and we don't know how to prepare them for like the real cold that's going to come. And so it's agencies like ours, faith-based organizations, that really come together. We're trying to collaborate. It really helps that, sometimes in crisis, the agencies, the forces that could come together and are able to make something that will provide some kind of relief for these families, right? So not, again, like just to what Lillie and Liza were talking about, we can't change policy, we can't, give them an entire wardrobe of clothes, but we can help in some kind of way. We can give them a few clothes that can fit them and their children. We can provide some resources. We can give them a weekly pantry card so that they come in and receive some food. But even then, we're cut short, right? Because a lot of them are living in shelters. They don't have a kitchen. And so I was just hearing about a story where they're like, for 3 days, we've had warm food. And I was like, what does that mean? And they said, well, they used to give us these frozen foods, and we used to put them out in the sun to just unfreeze. And it was just really heart-wrenching, because that means that the kids are eating like frozen food. And even like when they have microwaves and things, it's just, they're used to eating soups, they're used to eating these like warm, culturally different foods. And now they're just, they have to kind of just accept whatever is given to them. And then the other thing I kind of wanted to put out there was, a lot of these people are really, really hard workers. In order to do all of this, they really had to go through so much, and all they want to do is work. And so when they do work, they're the immigrant communities tend to be the ones who build the businesses, who make more jobs available. They, they're the entrepreneurs, and statistically, we have seen that immigrant communities do end up bursting the economy. So they only need to be given an opportunity, right? If we help them get an opportunity to just kind of be able to fend for themselves, to work their own things, like they can get out of the shelters. Like we don't have to have this crisis of them being in the shelters and us throwing them out of the shelters. They want to leave. They don't want to stay there. They don't, so I think that's kind of my spiel.
Thank you. I'm struck by you saying, and this is not necessarily a policy solution, but it's something that I think policy can facilitate, and that is that, especially with the current sort of influx, that some of the agencies are trying to work together. So often the our nonprofit community and our state agencies, we work in silos. We do our own little job and don't think about the whole people and the whole person and the whole family we're trying to serve. So I took as like sort of a good thing that you saying that that you're working together with other agencies to try and figure out how do we meet needs sort of comprehensively. As we kind of try to transition into thinking about public policy solutions and other public policy, public budgeting, and other ways that that we can do better. Some things sort of, I feel like there are some principles here that just sort of have come through, and that's basing eligibility and benefit levels on developmental, health, and nutrition needs of the child instead of the immigration status of family members. Reducing administrative burdens, reducing the barriers, those, and sometimes it's administrative burdens that have to do with proving eligibility, but I think what you've all talked about too are things like language barriers and technology access barriers and things like that. And then just more broadly, figuring out ways that we eliminate the link between immigration policy, which is one thing, and accessing the safety net, which is something different. So those are things that kind of, as you were talking, kind of came to my mind. So keeping with you, Carolina, from your perspective and experience, what could be done now and in the longer term to better support children in immigrant families?
Absolutely. This is a really great question. And there's just a million different answers to it. There's obviously the policy part, which is just allowing more families to receive that temporary assistance, that temporary just push that they need, whether it be, EBT, cash assistance, any kind of like public benefits, Medicaid, just the most basic like healthcare, food, and that goes a long way. But also kind of more immediately, like I was talking about, our organization, places like LSA, MASA in the Bronx, there's the New York Immigration Coalition that's been able to kind of help us collaborate all together. Funding for these agencies, right? We don't, the applying for grants and everything, that takes months and years sometimes. And we don't take months and years to respond. People arrive downstairs in the lobby and we find what we have in the thrift store. We give them coupons, we give them what we have in the back. We, welcome them in at the moment. It happens instantly. And we have our deliverables, we have our programs, we have everything in mind, and we drop everything that we're doing to try and help. So funding for agencies like this is super, super key, because like this is where we see the groundwork. This is where we're actively working with the people. We can do the applications, we can help them, we can translate, we pretty much LSA, like 99% is bilingual. And, we'd love to onboard other people who can speak different languages. There's more dialects and things that, it's not just Spanish and English. And we don't often have the capacity because there's just not enough funding. So I think that's a really big ask as well. The funding for social services agencies, community-based organizations that are doing the groundwork at the moment, respond in crisis. Also, just increasing information and having accessibility in Spanish and in Urdu and French and all of the Mandarin and all of the languages, the main languages that we're seeing come in, is really key as well. We have to pay more attention to the smaller things, right? So if we have a main website, like I was talking about, translated, but all of the answers are not translated, how is a person supposed to, answer, even if they go to a library? Often we have social workers placed at hotels and shelters that don't speak Spanish. They have an assistant who's supposed to, be doing something else and supposed to be translating, and their Spanish is not up to par. It's not culturally conscious. There's lots of different types of Spanish. And we can do better than that. We have to be able to give more information to people who need it, whether that be printed form, whether it be someone there trying to navigate people. I feel that human connection is key, right? So also people are not used to, even if you're given a pamphlet and you don't know how to read or write, this may present a really huge problem. The majority of people who have arrived to us, it was a friend that told them. And so the friend talks to the friend, talks to the friend, the entire shelter comes. And so that's really the best way to kind of disseminate information out there, in my opinion.
Thank you. Thank you. Lillie, are there policies that are working well, either nationally or in other states, or in specific areas that we here in New York State can learn from to address child poverty among immigrant families?
The golden question, isn't it? And yep. I think, yeah, and I do think that states that do end up successfully expanding a lot of their programs using state dollars. And I know that is a huge ask and not something that happens overnight, but we see it in DC and in California where they have non-nativity restrictions on even just like their Medicaid program. It makes a world of difference in terms of access and take up. So in the interim, because I know that doesn't happen overnight, I think it's really valuable for states to use some of these non-nativity restricted programs like WIC, like Head Start as touch points for referring out when access to, systems broadly is very limited to these really awesome programs that are generally underutilized, I think, in a lot of states. So I think using those as touch points is wonderful. And I think I've seen it in states like Maine where they do put a ton of effort into community navigators in some of these non-nativity restricted programs. As you're saying, Carolina, it's of the utmost importance to use your community resources and acknowledge that people's lived experiences really are their credential to do this work and bridge a lot of these gaps. I've seen tons of success with the implementation of community navigators in both mitigating a lot of these fears about accessing some of these systems and just reaching these communities more broadly. I know we talk a lot in this world about cultural competency, linguistic competency, but it's not enough to talk about it. It's enough to do something about it. And doing something about it, to me, looks like these navigator programs, hiring staff from within these communities and trying to bridge a lot of these gaps between organizations that are immigrant serving, ethnic community-based organizations, bridging the gaps between them and some of these systems. And in some states, they talk all the time. They have a really close relationship. In others, they have no idea who they're talking to. They have no idea who their state TANF coordinator is, who their state SNAP coordinator is. And so I think if states and some of them do, put energy into cultivating spaces where these gaps can be bridged, I think it would be hugely beneficial for folks to have the opportunity to build competency all around. And I think we see that happen in refugee resettlement, where there are federal requirements for communities to consult with one another about what a community's capacity is, where are some of the tender spots, where are some of the points of misunderstanding and friction. And communities are building off of this model. And, you know, consultation is really ongoing, but I think it would really be beneficial for states to implement some level of required consultation in which communities have an opportunity to consult with one another about how capacity is going, where some of the points of tension are, so we don't get to a point of widespread misunderstanding and generally placing the burden on some of these community serving organizations to demystify and debunk some of these things, when we could certainly require consultation because we've done it before in refugee resettlement. We just don't do it now, despite the many, many changes we've seen in the landscape. So I think it would be helpful. I've seen other communities step up and do it regardless of federal mandate or states putting any sort of resources behind it. But I think states that do resource it tend to fare better.
Thank you. Thank you. Yeah, that raises something that I think we haven't sort of just called out yet, which I think is important to remind ourselves is we often think of New York City and the rest of state, you know, differently. And a reminder that we have immigrant families across our big, beautiful state. And it just so happens we have folks from New York City in New York State on this panel, but really just that reminder that communities across New York State are trying to figure out ways of helping and supporting immigrants in their communities, and in many cases are very much are struggling under the weight of how do we do this. And your point about sort of it's helpful to have some statewide, or, you know, and in this case statewide coordination from the top, not necessarily bossiness, but coordination would be extremely useful. Liza, what is New York doing? What's New York doing to support economic security for immigrant families? And what could we be doing more of? And what could we be doing less of?
Absolutely. So there have been, you know, some really strong investments, right, into immigrant communities. Last year, you know, we fought and won a substantial amount of legal services funding, for example, to help immigrants to apply for citizenship, to do their naturalization, to do deportation defense in those situations. That was a really valuable investment. I want to shout out what Carolina said before about community-based organizations, like doing the help now and not when they get funding from a foundation 6 months, a year later, because you know, one thing that New York has done some of, but should be doing more of, is really facilitating our community-based organizations, and particularly our immigrant-serving community-based organizations across the state. The New York Immigration Coalition is a statewide organization, so we do have offices in Syracuse, and Buffalo, and Albany, and there are some phenomenal programs that are available in those areas to support people. In fact, we've seen a huge revitalization in Buffalo due to the increase in immigrants there. So I think it's great to recognize you know, these ways that immigrant communities actually don't just, you know, they're not taking resources, they're creating resources. They're creating revitalization of a lot of places that obviously New York City has a lot of people, but there are many places across the state that people have left, populations are down. An increase in immigrants in those spaces actually does a lot to revitalize business, community, everything in those places. So it's not directly to your question, but I did want to note that there's also, you know, increases in immigrants have a positive effect on things like inflation. I think Forward US had done a really interesting report on that one as well. In terms of what New York State also, you know, has done well, I think we have seen certain programs where they've rolled them out the way that we would like every program to roll out. Child Health Plus is a great example, right? Any person under the age of 19 in New York State can get health insurance, regardless of citizenship status, regardless of income, you can get health insurance. That is the kind of program that we want to see, a universal program for children where, we don't have to go through all of the means testing, all of the immigration questions, families seeing like this might get reported to DNS if you say something. Like, that's not necessary. We don't need it. It's expensive to do those things, right? It's not a cost neutral thing to add eligibility requirements to these things. That requires staff, it requires work, it requires paper and thinking through an entire eligibility standard. Those are not things that are cheap or not time consuming. So we really shoot ourselves in the foot to some extent when we do things that way. And I will say New York has some other things that they've also done well. For example, New York State, the Empire State Child Credit, right, which is a refundable tax credit that families with children are eligible to receive in New York. Now, we saw the influence that the federal child tax credit had on child poverty. It cut child poverty in half across the whole country. And unfortunately, when the federal enhanced tax credit went away, those families, many of them fell back into poverty again. Now, New York State does have a child tax credit that is inclusive of what we call individual tax identification number filers. So that's immigrant tax filers, immigrant taxpayers. So if you're not a citizen or you don't have a social security number, but you do work and you pay your taxes, and immigrants pay a lot of taxes. Even those who are undocumented pay billions of dollars in taxes. So they're paying into and subsidizing a system they may not be getting things back from. And so the child tax credit in New York State does include our ITIN filers, as we call those people. But the earned income tax credit doesn't. So, there's a lot of discontinuity with the eligibility there. One thing we've been working on this year, and we've worked alongside Schuyler Center and LSA and many of our other colleagues on, is passing what's called the Working Families Tax Credit, which was a bill Senator Gennardis has championed that would take the Empire State Child Credit and would take the Earned Income Tax Credit and just put them into this bigger, better tax credit that gets families more money, helps fill that gap that the federal child tax credit left, that includes ITIN filers. So we're not cutting out our immigrant taxpayers and their children. That would increase the amount of money that families are getting. And that would, if possible, give those payments more like the enhanced credit did. The enhanced credit was paid out to families every month. So they were getting money when they needed it. So we have included a quarterly payment system for the Working Families Tax Credit as well to get families in there more often. So those are ways that we can directly give, money to families to pay for what they need. And I do want to say, because we hear pushback from this sometimes, we've done reporting. UNH did the SHARP report that showed what families actually spent that money on. And by and large, it was like 99% food, housing, childcare, school supplies, just basic necessities. People were not going out and spending this money on things they didn't need. They were spending on the things they did need and that their children needed. So really recognizing that immigrant families and our families in New York, like that need this money, should just get the money, right? We don't need to create crazy barriers for this. They spend it on what they need. They stimulate the economy when they do it. They're not keeping that money in their pockets. They're putting it right back in to the New York State economy. So that's one thing. Language access is another one that I spoke about earlier. Currently there are some language access protections, right? So Governor Hochul codified what was called the 26.1 executive order back in 2022 that basically guaranteed that for state agencies that the governor directly supervises, they're required to put all vital documents. And of course, these are all these keywords that people are like, what's a vital document? Into the top 12 languages now in New York State. But New York State has over 200 languages, right? It is what we would call a super diverse community. And so if you don't speak one of those main languages, then your ability to access any kind of information is seriously stymied by that. So we've been pushing to expand that language access to include both agencies that it doesn't currently cover. So if you are an immigrant, you need to go to the Department of Education for something, or the DMV. Those are not covered by this law. So we are trying to expand that to make sure that immigrants at all of these places. Well, we know that you don't need documentation or an immigration status here in New York anymore to get a license. We passed the green light law, which was a huge, wonderful thing that we did a few years ago that allowed those without documentation to get a driver's license, because we knew our migrant farm workers still have to get to work. They still have to drive their children to school, and they know how to drive, right? This isn't like, you're not putting people on the streets that don't have anything. Those are all ways that we can, really improve that. So we're looking for that. We're looking for things like community interpreter banks, right? So for these languages that people don't speak as often, I think Carolina's probably seen a lot of indigenous languages from Latin American countries. We see those. We've seen a big increase in African communities as the situation in Africa has changed. And if you speak Wolof, for example, then you may have a much more difficult time finding accurate information, even from state and city agencies. So those are two big things. And then finally, I would say, local like municipalities, local governments can also do things to expand on what the state is doing. The state needs to make these big administrative changes to open up childcare, to open up these other pieces. But a great example of a city stepping in would be New York City's creation of the Promise New York City childcare program last year, which was a program that just said, you know what, we know that children of immigrants who may not be eligible for other forms of childcare subsidy, but are still in economic need of these things, deserve to have them anyway. And we need those people in the workforce, and we want to make sure that that happens. So New York City put this year $16 million into its own budget to provide a similar level of childcare funding for those families that aren't eligible for the other one. So creating parallel tracks for our families is another way to do that. And I do want to give credit, where credit is due there, because the implementation of those programs also did some really important things. For example, often when there's income eligibility standards for a program, a parent, for example, may have to then go to an employer and ask for proof that they work there. If that person is undocumented, that employer may not want to sign that piece of paper, because then they're admitting they're hiring somebody who maybe isn't work authorized, and they don't want to be liable for that. This program did a really great thing because it let parents sign an affidavit that just said, this is how much I'm making. So we're saying, you know what, we trust you that you're making this much, and we're recognizing that there are barriers to your, getting this information in the same way that other people might. And now, I think in the last year, I think it was about 664 families got access to childcare in New York City because of that parallel track. So we want to encourage that the state looks at both of those options, that says, okay, we need to decouple funding where we can to expand access to critical programs. We need to create new programs like Promise New York City on the city level, or I know there's a SNAP for All campaign, right, going on the state level, to create, another funding line for SNAP benefits for families who are not eligible because of immigration status and other concerns. So there are lots of things that we can do. And I think New York has done a really phenomenal job in a lot of ways at recognizing the populations that we have. And, when we needed it, there was an excluded workers fund during COVID, during the pandemic, where we recognized how many immigrant workers were not going to receive a check from the federal government that everybody else received in order to help them survive during the pandemic. And so New York stepped in, and they put in, I think it was like $2.3 billion to go directly to immigrant workers who had lost income because of the pandemic. So I think there are lots of ways that we can recognize the challenges that, some immigrants face due to immigration status and other things. But New York knows how to do these things, right? Yeah. New York knows how to decouple, and we know how to, create new funding lines. And we do have the resources here to do this. So, what we really need now is the political will, I think, from our governor and from our Senate and our Assembly to look at who is a New Yorker and who New York, who makes up New York, and to recognize those contributions in the same way that we recognize them for everybody else.
And I'm thinking of the analogy of, and at a time when, people are sort of unsteady, how do we fertilize, how do we provide nutrients of all kinds to families when they're, just getting on their feet. And I think the other thing that you called out was sort of sharing the things that have worked and what works about those. And then I want to just call out one thing that I want to be careful not to let our state leaders off the hook, because while New York City has the kind of revenue and tax base to be able to implement certain things on its own, there are communities that just don't have that capacity. So what I don't think we want to encourage is the state leadership saying, you counties or you municipalities just do this on your own, like some others did. I just want to be mindful of that.
Absolutely.
Some of the very communities that have the largest percentage of poor people are places where the cost of living is low and immigrants may be going. And they might not have the capacity on their own to do the same kinds of things. So I just want to kind of, warning.
Yes. No, and I 100% agree with that. I think, locations can create great programs, right? And they can fill needs quickly sometimes, depending on when in the year, right, things are happening. If the state budget just passed, the city steps in, okay. But the state is the place with the most money. The state is the place with the most power. And the state is the place that has the highest ability to coordinate. So, because of all those things, the state should be taking the lead on all of these pieces.
So we have a question in the Q&A that is specific to Syracuse, but I think it's also could be, we could make it broader. So I'm going to kick it out to you all. This person is specifically talking about doing a forum in Syracuse on the importance of advocacy for pregnant families with children who are 0 to 3 because of the critical period in brain development that happens during those times. And that person's going to be asked for 3 places to recommend families as a place to start. Like, where do they go? And if you had three suggestions to give this question asker, what would you say? And I'll say, like, particularly if it was an immigrant, family that was looking for services. And I'm going to jump in and say, especially because I know Syracuse has a federally qualified health center. The federally qualified health centers are one place that a person can go with their family to seek care, and also to try and help figure out if they qualify for or what insurance they might qualify for. So that's one answer. And what other answers would you give to somebody who's looking for pregnant families with children who are age 0 to 3?
Yeah, Lillie, go ahead.
I do not have a great New York specific answer, so maybe we can tag team it. I just have my federal policy answer, which is, I think, usually WIC programs are wonderful, and the coordinators, in my experience, have just been a delight to work with. And also the home visiting coordinators. Home visiting is a criminally underutilized program, I think, at the federal level, which all states have, and usually the coordinators are wonderful. I'm happy to share specifically the titles of folks that you would want to connect with. But as far as federal programs go that are non-nativity restricted, WIC, home visiting, both underutilized and great for pregnant families with young children.
Fantastic. Thank you. And thank you for mentioning home visiting. That's, we agree, criminally underfunded, underutilized. And yeah, thanks.
Yeah, absolutely. Honestly, home visiting was going to be mine as well, or one of mine as well. Home visiting programs are probably the best programs that we have in terms of that particular age group, particularly because many of them start at the prenatal time. So while the mother is still pregnant, she can start getting that medical assistance and the kind of supportive education on child rearing and what some of these milestones are, and that can happen before the child even arrives. So that's a fantastic one. I don't know offhand all the Syracuse programs, but if you share your information, I'm also happy to connect you to our office in Syracuse, where they may have actual specific organizations that do assistance. I'll say things like, Head Start, early Head Start, is that what it's called, Lillie? Kick me if I'm wrong there. But, there are also, again, federal programs and, state programs that do allow younger children in. So if you're 2 or 3 years old, there's some support. But it's an interesting time, that 0 to 3 age, because it's really a bridge between the healthcare and the education. And sometimes it's a very blurry line for people where one begins and the next takes over. So, looking, I think, at a lot of health resources are also really important, making sure that they're getting connected early to the hospital that they're planning to go to. You have some time in the beginning to research. If there are, multiple hospitals, for example, there may be one that has better language access than another, or has, a greater or more diverse staff, for example. And those are good things to try to look into early, and to recommend that your parents look into early. But overall, I'm very happy to share a connection and see if I can find for you a few actual, names of programs that you can recommend your families to.
Yeah. I am a little bit more familiar with the New York City one, unfortunately, but I do know that, for example, even immigrant families that have a pregnant mother here and the child will be born in New York City can apply for food stamps. So I'm not sure if that's the case in Syracuse, but I think it's definitely worth to look into. And additionally, I definitely would also suggest the home visiting. We have a parent-child development class, and I have seen that is really, really helpful. So I'm sure that there's programs all around New York that also do these parent-child development class. These tend to be like more of mommy and me or daddy and me programs, where the child learns to socialize. And so that's really great because it enhances, the secure attachment, and just prepares them to be able to go into school. And it also gives you an exposure to resources, as well as any kind of like language accessibility. So a lot of these places will be community-based organizations that can speak your language, and then kind of give you all of this access. So that's definitely something I would recommend.
Do folks have recommendations? This is another question that's more related to when families have a child with a special need. So recommendations for where an immigrant family might go when they have a child with, who's medically fragile or has a physical or intellectual disability. Do you have recommendations there?
I have a New York City recommendation. Unfortunately, they don't usually do things statewide, but Advocates for Children is a wonderful organization that works in New York City. They've got a lot of lawyers on their team, everybody else, and they really specialize specifically in early childhood and early intervention, and making sure that immigrant children especially are given the resources that they're actually required to get from the city and the state in terms of their special education and early intervention needs. So I would absolutely check them out if you have New York City specific needs. They also, do have obviously statewide like understanding and organization. They don't do on the ground work. If you're in New York City, you can actually call their helpline and they will like help directly with individual cases though. So that's a fantastic resource. Their website also has great information that's, more encompassing on these.
.org for anybody who's okay. I second their great work. So, and although they're in New York City, I think their website and yeah.
Yes, it can be a challenge because the language barrier often means that children get misidentified. Either, especially in the early ages, either they are told they have special needs when they don't, what they actually have is language barrier, or alternatively, sometimes a language barrier is mistaken as just that when in fact the child does have special needs. So I think looking into that, just the need for more bilingual and multilingual professionals in these spaces is critical. We don't have enough bilingual teachers. We don't have enough bilingual early intervention specialists. So, really supporting the pipeline to those programs would do a lot to make that even better for families. But it's something to look out for sure.
Yeah, I don't have much to add to that, but I also just wanted to call out that I think there's just such a gap in the literature on this particular question. Just broadly speaking, I think that the intersection of immigration and disability and disability justice is quite underdeveloped. And I think as a result, we don't often have like the ideal policy solution for these things, other than I think I totally agree with what you said, what's already been said on just staffing up. But I just wanted to call out that I think this is a gap that we see nationally, and one that I think folks are starting to address, but is still very underattended.
Yeah, and you made the point earlier too, Lillie, about sort of navigation services, and that I feel like we're catching on to that in New York, and some, in our health system. There's, we're building sort of some better community navigation in some areas, but I think we've got a ways to go, and especially language and culturally responsive community navigation that's paid for, right? That's resourced. That's not, as Carolina said, sort of someone who's actually supposed to be doing some other job, but since they speak a different language, that we drag them into it. Well, we've got a long way to go. Go ahead. Go ahead.
Yeah, sorry. I kind of just wanted to speak a little bit about this recent arrival kind of dilemma that we've been facing has just kind of been an enhancement of the long-term issues of immigration. I think this question about caregivers and child with special needs is especially will highlight that factor. We have cases that we've had to kind of work together from different departments because it's just such a delicate issue. For example, we have an undocumented mother who has diabetes, couldn't have any type of health care, and is also blind, also low income, single mother. And at that point, it is really frustrating because this is clearly a person who needs help, right? And even if they have the most basic health insurance, which is emergency Medicaid, due to her documentation status, that means that she doesn't really have a primary care, only a free clinic on Saturdays. So if something were to happen during the week, she has to wait until Saturday to be able to be seen. So this is really problematic because that means any kind of other specialty things, they can't be attended to. And then you have, a child that's pretty much taking care of her mother from a very, very young age and is, failing her classes now because, the child is American born and a US citizen. But because she is growing up in this household and having to take care of her mother, she's not able, she's now 20 and she can't finish high school. And so, these are very long-term problems. And now that it's more people in need of help, we're kind of seeing it a little bit more. And it really is such a tragic incidence of, what's happening outside of the US, but also, our response to it and how compassionate we're being with people. And I kind of I wanted to put that out there and highlight. But I also wanted to say that I was also really impressed by the response of the people, by the people who did want to help, who would drop everything and just come and volunteer, because we honestly wouldn't be able to do the work that we do without the volunteers that we have. And kind of a word of advice to the people who have been struggling here. We tried to give them a little bit of a breath of fresh air They have more opportunities here education-wise. People who have never even dreamed of finishing high school are now on the path towards college. And I think that's really, really strong. And that's something that we should be encouraging for immigrant communities to do, because they are hard workers. They are really good, honest people. And they're capable of so much. You know, when you go through all of these difficulties, it just kind of makes you a fighter. And so that New York State in general has been one of these really growing places for flourishment. Thank you so much.
And Carolina is a great example of what you get when you put in those investments, because she, you know, she has a wonderful personal story herself, and you can see that, you know, when we invest in our people, they invest right back.
Thank you. Thank you so much. Thanks to all of you. I'm always inspired to know that we have each other to work, that we have a lot of really smart, passionate people who want to make things work better. So thank you all. We've got to work together to make things happen. So please join us, join our Schuyler Centers doing work with many of you, and many of you who are on call around child poverty, around really moving the needle on child poverty, inclusive of immigrant children, inclusive and with attention to racial equity. So join us, and we really appreciate it. And thank you so much to our panelists.